Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of embryology with the topic neural tube defects. So let's start.
Welcome to the examination. We will focus on neural tube defects today. To start, can you briefly describe the embryological basis of these defects?
Neural tube defects are congenital malformations caused by failure of neural tube closure during neurulation.
That's entirely correct. Now, what is the primary diagnostic marker found in maternal serum that can indicate a neural tube defect in the fetus?
Primary diagnostic marker found in the maternal serum that can indicate a neural tube defect in the fetus is alpha fetoprotein, which, if raised during amniocentesis, can indicate a neural tube defect.
Yes, that's right. Elevated alpha fetoprotein levels can be a sign. So, what is recommended to pregnant women to help prevent these defects? What role does folic acid play?
Prevention is by preconceptional folic acid therapy, which starts 3 months before conception. 400 microgram daily prevents about 50% to 70% of neural tube defects.
Excellent. Now let's consider a clinical scenario. If a baby is born with a protrusion of the spinal cord and meninges through a defect in the spine, what would you call this specific type of defect?
I don't know the answer. Can you explain?
That would be called myelomeningocele. It's a more severe form of spina bifida. Could you tell me about the milder type where only the meninges and cerebrospinal fluid protrude?
It's called meningocele.
Yes, that's right. That's meningocele. Now let's discuss teratogens. What are some known teratogens that increase the risk of neural tube defects? Anything specific in the mother's diet or medication?
The risk factors and teratogens that can cause neural tube defects is number one, folic acid deficiency in maternal diet. In case of maternal diabetes, hyperthermia, and if the mother is on valproic acid and phenytoin, that can...
Excellent recall. You've covered the major ones there. Just to clarify, when you mention hyperthermia, are you referring to maternal fever or some other cause?
In case of maternal fever, yes.
Yes, that's right. High fever can be a risk factor. We've discussed the basics, diagnostics, prevention, and risk factors for neural tube defects. Do you have any questions or would you like to move to another topic?
Can we talk about myelomeningocele?
Certainly. Focus on myelomeningocele specifically. What are the common neurological deficits associated with this condition, depending on the level of the defect?
Myelomeningocele is the most severe form of spina bifida. It is the failure of caudal neuropore closure during neurulation. It leads to open neural tube defect with exposed neural tissue. The clinical features would be motor deficits, which is paralysis or weakness, sensory loss below the lesion, and bladder and bowel dysfunction, and orthopedic deformities, which is clubfoot and scoliosis.
Excellent description of the bed deficits. What are some of the common complications associated with this, particularly concerns related to the brain?
There is very low mental development.
Mental development can be affected, but what specific brain complication is very frequent, often requiring a shunt? Are you familiar with hydrocephalus?
Yes, it can cause Arnold Chiari malformation type 2, which can lead to hydrocephalus. and its treatment is by placing a VP shunt.
Exactly. Arnold-Chiari malformation type 2 and hydrocephalus are key considerations. You've demonstrated a good grasp of neural tube defects. Is there anything else you'd like to discuss within this topic area?
No, thank you.
You've done very well today. That concludes your examination on congenital anomalies.